In other developments, ministries of health across the OCES are strategizing on the sub-region's pitch for continued financial support for HIV and AIDS programming. Led by the OCES Regional Coordinating Mechanism, ministers of health and top-level personnel in the various ministries met in St. Lucia to decide on the way forward. The OCES RCM has been in place since 2005 and is charged with facilitating grants from the Global Fund. These grants are for the treatment and care of persons living with HIV and AIDS. Joan Dinier is a member of the RCM.
This grant enabled us to procure ARVs and to put many people living with HIV in the OCES on treatment. There was a lot of progress made under this grant.
Dominica's health minister says tremendous work has been achieved under the assistance of the Global Fund. But now that the aid has dried up, the OCES must sharpen its ability to attract new funding.
Because we are well aware that the first tranche of money from the Global Fund would have expired, but the HIV, AIDS, TB, and other diseases, STIs, and epidemic continues. So this means that we as governments, the respective governments of the region, have to find finances right now to continue this wonderful program and this wonderful work that we've been doing. Because while we still see some numbers, especially in certain regions, increasing in HIV, we can be proud of ourselves as to the progress we've made in the management, first of all, diagnosing and management of HIV/AIDS. Over the past maybe half a decade or so, we would, of course, have had antiretrovirals at the disposal, making people living with HIV, AIDS, and TB life a bit more longer. So no longer is HIV/AIDS considered a death sentence, but with proper management. So, of course, the challenge right now we have as a government and health ministers in particular will be right now to continue this program. It's one thing, of course, asking people to come forward to get tested, but, of course, after being tested, then what? We do have to continue the management plan, the antiretrovirals, the laboratory tests, the CD4 count, etc.
St. Vincent's health minister, meantime, notes the strides of the region in combating the deadly disease.
The HIV/AIDS situation in St. Vincent and the Grenadines, we have been noticing a drop in the number of infected persons and also in persons who are dying as a result of HIV/AIDS. So the RCM has been impactful to St. Vincent and the Grenadines in this regard. We have been able to provide persons living with HIV/AIDS with antiretroviral drugs, which enhance life capacity for some individuals whom we stated could live 20, 30 or more years, normally being productive, because you and I know that diseases tend to affect the productive sector of our society, and if one sector is not well, this society, the growth, economic growth and every other thing would be stagnated or very slow indeed. So it is imperative that we really and truly have our productive society, a productive sector of the society healthy, well educated, working well, and in good condition, good well-being, so that they can produce for the country, they can help in the development aspect of our OCES and the various individual countries in order for us to move forward. No use having a population of about 40% who are productive and then you have only 25 or 30 producing, because that is really putting a lot of burden on those other persons within society.